I appreciate the question expanding beyond doctors. You know, I work in healthcare. My background is, you know, I was a nurse in the emergency room. I worked on a medical floor and post-surgical floor. And I can tell you in the last 16 how much harder it has gotten in the healthcare industry. And, you know, this government was the one that back in 2015 said that every single British Columbian would get a GP. But unfortunately, the situation has only gotten considerably worse. And if I were, I mean, it's a big question, but if I were to simplify this complex issue, I would have to say it's workload. Is the biggest issue. You know, we're over census, we are understaffed, and the complexity of the work that we're facing has been increasing, and the North Shore Clinic closing, the walk-in clinic closing is a prime example of that. You know, this is not supposed to be a primary care clinic, but that's exactly what it's become. So I totally understand the situation that they're in. But it's going to put a lot of pressure on the ER and the other walk-in clinics, but probably, you know, by far more importantly, is what are people going to do to access those medical services? We have 19,000 people that were registered to that clinic that have to go somewhere. So that we're in a really tight spot. And then you add that on top of that, even before this, the wait list for MRIs, for the emergency room, for ambulances, for surgeries was just really quite long. So we're in a really, really tight spot. And actually, I would go as far as saying that we're in a full-blown crisis here in Kamloops specifically. We are ground zero. And the retention rates of nurses and of care aides is only about 50%, so because of the workload. So we need to be really cognizant of that. But frontline healthcare workers are also facing you know, acts of violence above any other profession out there. Long-term care facilities are only being staffed at 91%, like only 91% rather, of long-term care facilities are staffed at the government's own minimum staffing levels, but here in Kamloops it's 100%. So like this is a very serious problem that needs to be dealt with. And you know, in my opinion, we don't have our platform on healthcare out, but I can, you know, speak pretty strongly to this, that we don't need to spend more necessarily to fix the problem. It's really about allocating resources a lot better. You know, so we need to focus on creating supports for workers, and you know, and reducing the workload. That needs to be the focus. And to do so, we need to start training more of the types of workers that we're missing out on, particularly nurse practitioners. You know, paramedics, ultrasonographers. We've had, you know, positions in this province, you know, open 3 or 4 years that still don't have ultrasonographers. So in addition to that, we absolutely need to increase home care services and community services so seniors are able to stay in their homes longer. It's far cheaper to make sure that they stay healthy than it is to treat them in acute care. And we need to maximize surgical capacity. There was a pilot project that was done down in Richmond for knee and surgeries, and they were actually, just by altering how the OR operated, not increasing funding, what happened was they were able to reduce the wait list from 20 weeks or 20 months down to only 5 months. And then once the project was over, we never heard from it again. But we do have evidence-based programs out there that we could be doing. But probably the most important thing we need to do is integrated healthcare. And I've been watching other provinces just, you know, like flourishing with this new model. And what it is that we don't need to see a doctor every single time. Sometimes it's a nurse practitioner, sometimes it's a social worker, a pharmacist. There's other practitioners can deal with the issues. And it doesn't have to be in a brick and mortar sort of concept either. It can be done through telehealth, and the same with, you know, with specialists. The problem is, and I understand that we have, you know, 2 new clinics coming now, but again, here we are 2 months out of an election, and only now are we seeing this happening. Well, we've been a decade behind other provinces that have been doing this already. So I'm not entirely sure what sort of an impact it's going to have when we are in such a bad crisis. And finally, just one more point I'd like to make is that, you know, we are the only province that doesn't have a poverty reduction plan. And yet poverty is the #1 key determinant of health. So we need to make sure that seniors don't have to make the decision between taking a medication that keeps them healthy or paying rent. If we were to do that, you know, there's $9 billion is how much poverty costs us in this province. To solve it would only be $6 billion. We could take that extra $3 billion and actually improve services so that everybody has access to that.